Thank you, and I'm excited to be here and to be a part of this initiative, because when we launched Hope for Healing, really it had three main components, and the first was really to break down barriers within state government, to make sure that agencies were collaborating, talking about best practices, evidence-based best practices and outcomes. Then beyond that, and that's really where this grant is coming in, it is incorporating the communities. It's not a top-down state approach. It is the communities who are the driving factors behind the success in helping people in need. And so that goes beyond just government, because we've always said that government is not the solution. It is a part of the solution. And so therefore we are working with the private sector, as you can see here. We're working with law enforcement. We're working with our educators. We're making sure that the faith-based community is involved, the private sector. Everybody has a hand at the table, and that we're not going down separate roads, but we're working together, again, with a unified goal, and that is making sure that we're helping people in need. And really the Hope for Healing initiative, this is where I see it going forward, because it is one thing to provide somebody with help, it is another thing to provide them with hope. And we have to make sure that while we are giving them the treatment and the services that they need to be able to battle the addiction, we also have to make sure that there's a light at the end of the tunnel. And that comes in the form of hope and opportunity and living the American dream. And so I really think that this grant, as we're looking how it works in Seminole County, I think it is a great driving force for best practices. And I was excited to hear a little bit earlier when we were talking with the good folks back in the room, saying we're going to measure this, we're going to follow the data, we're going to follow the evidence, and we're going to make sure that there are good outcomes. And then this could be a good pilot, but a good first step to implement it statewide, because at the end of the day, what this is all about, they're good people who are suffering. It's just making sure, especially in these difficult times, that they're getting the help that they need and the hope for the future, and that's really what this is about. So I'm honored and privileged to be a part of it, so thank you.
Great. All right. Katie Bowman, can you just tell us a little bit about your story and where you were and where you are now?
Sure. So in September, I celebrated 8 years clean from my demons of opioid addiction, and it was a lot of things that got me to that 8-year mark, but I was sharing with folks in the room before that this epidemic is really an addict's dream, because we love isolation when we're alone. We like to be alone with our shame and our guilt and our addiction, and I'm so happy to hear of a program and a place where people can go to get that help, receive that connection that we need, connection with my community, connection with a good job that I could earn a good livable wage working and supporting myself, gave me that hope that I needed to turn 6 months into 1 year, 1 year into 2, and 2 now into 8. And service opportunities to give back to the community is also a really pivotal part of giving people that hope. So it is a combination of important people in this room that are making something really great happen for that forward momentum in this battle against opioid epidemic. And I'm glad to see that there is still some light and some importance being shed upon that issue, because it is still such an issue, and can't wait for the center to open. I hope that I will be able to give back in some capacity once the center's open, and just help share that hope, because that is such a big part. And then support for the families. I know that's a big part of what you guys are trying to achieve, because navigating addiction is scary for the person suffering from it, but I would imagine it is even scarier for the families. So giving them that navigator and helping them figure out treatments, best ways to stay clean, best ways for the families to support them, and those other avenues is going to be really pivotal in turning this around.
Great. Well, thank you so much. Dane Eagle.
Thank you, Governor, and thank you to the First Lady for their commitment to continuing to fight the opioid crisis. This is something that they were committed to right out of the gate, and here we are in the middle of the COVID crisis, and it's something they haven't let up on. In fact, they're doubling down because it is needed. As Katie has mentioned, isolation, quite frankly, unemployment, that breeds addiction, and we need to continue to address it. So I'm very pleased for the opportunity to work alongside them to focus on this. The Department of Economic Opportunity gets to do a number of wonderful multiple great things. But as we pull ourselves out of this current crisis, the COVID crisis, and get ourselves back on to getting people back to work, we can't lose sight of some of the substance abuse and mental health issues that are out there. So I look forward to partnering with this community and others as we implement this pilot program. And as the First Lady said, this isn't a top-down approach. While we will be working on behalf of the Governor and First Lady to administer these funds, we're going to be looking at these organizations within the community to help us pinpoint exactly how can we solve this problem, how can we get down to the individual in that community, make sure they're getting the services they need, and then duplicate that or replicate that on a statewide basis, and actually have measures that we can look to and try to get that done. So we'll be working with CareerSource, with Seminole State College, and Project Opioid, with the Sheriff's Office, and quite frankly, with community leaders who have a keen understanding and advice of how we can solve this crisis. So once again, thank you to the Governor and First Lady, and I'd be remiss if we didn't thank the President and his administration, as this is a grant from the Department of Labor, and they certainly care. So thank you for this opportunity.
Great. Sheriff Dennis Lima.
Well, thank you, Governor, First Lady, and welcome back to Seminole County. And as you know, I've had the privilege to work directly with you and your administration since the first day that you took office, and you have not wavered in your commitment to protect the most vulnerable. So I thank you for that. Central Florida thanks you, because the $400,000 appropriation that we have for our Hope and Healing Center here, combined with our partnership with the public-private partnership and Advent Health, quite literally is going to save lives. But to talk about the stats that you're seeing right now, what we're seeing is an unprecedented now dependency on substances and co-occurring mental health issues. In Seminole County alone, we have nearly just shy of 600 overdoses since January 1st. And I think if you look at that, that's pretty standard in populations our size. What's frightening is 76 people have died of an opioid-related overdose since January 1st. That's a 15% increase. And there is no question that the isolation and collateral unintended consequences of COVID-19 stop people who were in treatment. Those that had life problems before that only became more complicated as they lost their jobs and worried about the economy and all of these other things. So we have to be prepared to take on these responsibilities. We know that through Project Opioid, we have a very, very unique partnership that we're going to move statewide with the Governor and the First Lady's assistance. This brings in public and private sector and faith-based partners to really collaborate on strategies that are science-based best practice strategies that not only help the person who is navigating a course towards a path to recovery, but also help their family members as well. This is an incredible opportunity for the state of Florida, and we are just absolutely blessed to be a part of it as we continue to fight and help reunite families and save lives. So thank you both. Thank you, Governor.
All right, Mimi, go ahead.
Thank you, Governor and First Lady. Again, I echo the sentiments of the team here before. It's an honor to be able to do this, and I'm so appreciative that it's a workforce development grant, too, that we're able to take talent and train people to explore careers and make new decisions for their lives. Self-worth is around a career. You want to feel good. You want to be able to support your families. And the efforts of this grant, which is such a community collaborative approach, is how we're taking this, is going to involve kind of three things. We're going to work with our career seekers and help them transition. Maybe they have been justice involved or had some mistakes due to this epidemic. Now we're going to be able to benefit on that and be able to be treatment centers and be able to have them be peer counselors and help individuals and remove that stigma and get them back into new careers of something that they didn't realize they could do but do have the talent for. These dollars are going to help that training and be able to give those skills upgrades. We're going to assist businesses to be able to recognize and address when these issues are there. Right now, businesses may not have the expanded EAP programs to support and be able to address this and lose a good worker when it was really just an addiction, or it could be a family member that's suffering this and it's having an influence on their lives. So we're very appreciative about that. So I love the fact that it is a collaborative whole system of care approach that this community is going to do. So I'm excited that Department of Economic Opportunity has recognized that in Central Florida we're going to have 3 different workforce boards work and put about $3.6 million right here of this grant to be able to help these. So I thank you.
Great. Thank you. Bob?
Thank you, Governor, First Lady, and Director Eagle for being here. We're honored to host you here at Seminole State College, honored to have all of you here to announce this tremendous opportunity for the grant. And, the job opportunity is one of the things that's going to help those that are suffering through the substance abuse. But it has to come also with training and workforce. And here at Seminole State College, we're ready and willing to assist in every which way we can. The legislature has done a great job in providing policies that have helped eradicate the substance abuse disorder and opioid crisis. But it also takes funding from the state and the federal level, which has been coming. But it is important to continue the collaboration that we see on the local level. Collaboration from entities like Project Opioid, the Sheriff's Office, Advent Health, and all the other partners, Career Source and everything else, that locally, faith-based organizations and the private entity that come together to say we have an issue in our community and we want to fix it. We want to thank you for your efforts to recognize that the substance abuse and the mental health go hand in hand and that there's a need to address it and not ignore it. And here at Seminole State College, we're ready and willing to assist you and anybody else in helping with this cause. And I thank you for that.
Great. Well, thank you, Bob. And Dane, you want to talk about just the importance of employment? I mean, I guess, we look at different things sometimes in isolation. I mean, the way I view it is, the healthier the economy is, the healthier society is, all the key things. Even if you're not doing anything directly that is going to help us, and obviously then we come over the top and try to do more. Certainly, and thanks to the governor and pushing to have our state reopen and start moving the ball forward, the unemployment trends have been positive. And yes, we have a lot more work to do, but certainly at the height of the crisis, we had very high unemployment numbers, record high unemployment numbers. And that sort of situation isn't good for anybody. Nobody wants to be unemployed. No one wants to have to call DEO and look for reemployment assistance, not the claimants, not government, not anybody. The best thing we can do is find meaningful, gainful employment, and I think the majority of Americans are looking for that too. So it's important that we continue to, quite frankly, reopen the state, but the governor has challenged the Department of Economic Opportunity with making sure that workforce development projects are in place so that we can get people who are looking for employment off unemployment assistance and back out and getting to work. So we are focused on that instrumentally and look forward to moving things forward. But as he mentioned, as we have the unemployment numbers, if they are increasing, you got people that can't find employment. They can't go to work. Everybody wants to be able to put their best foot forward, be producers, be able to feed their family, put food on the table. When you can't do that, it breeds frustration, and it might breed a situation where Katie's discussing where they fall into perhaps relapse or the first time finding themselves addicted to substances. So this particular grant is going to be extremely helpful as we pull out of the crisis to be able to address those individuals, address their needs, make sure that they can find unemployment so they can put their best foot forward, get back to work, put food on the table, but also find ways to break down those barriers and try to curb some of those relapse situations. So we look forward to digging in further with our local community partners, but we're on track to do some great things here, thanks to your leadership. What would you say that was the most important thing in you turning the corner? I know it's been 8 years, but...
Well, finding that gainful employment for myself was a key component. As Mimi mentioned, that really helps with the lack of self-worth you feel when you're coming out of a long addiction. So finding that purpose, but also the benefits that I received once I got a good position, working full-time for therapy, medication-assisted therapy, and having access to therapists and doctors so that I could use some medications to help me get through those first few years. I did the Suboxone therapy under the medical care of a doctor, was in mental health counseling for the first several years, and had I not had a job with benefits, I don't know that I would have been able to pay for that without having a good job working and supporting myself.
So as we look to deal with this, when people get addicted, is it with the opioids, is it still more of legitimate kind of medical need, get painkillers and get addicted, or is it more stuff that is that is kind of black market, just recreational drug use that's the biggest problem, would you say?
I think the recreational drug use is kind of taking over a little bit more just because it's becoming more prevalent. Drug dealers see that there is a higher level of addiction, so they only have to maybe sell it once or twice, and they have a whole new group of people very heavily dependent upon that substance because it is so powerful. The opioids are way more powerful than I think a lot of the other recreational drugs people were using in the past.
What are you seeing in terms of drug ED visits, overdose visits, deaths from drugs beyond just opioids? Because I think, we've looked at the statistics and, we have seen the increase in opioids. Fortunately, I think we've seen it somewhat flatline over the last few months, still flatlining at a much higher level than we were, but at least stop the increase statewide. And the heroin's actually gone down, but it seemed like it all definitely started going up March, April, with the fallout from the pandemic. So are you seeing that in other types of drugs beyond opioids?
Well, mostly here in Central Florida, Governor, we're seeing it in synthetic opioids, drugs that are manufactured in China, sent into another country, coming across the border, and then entered into the house. And put it in the simplest terms, somebody who's been taking an 80 milligram Oxycontin pill that can no longer get it from their doctor is going online and picking up a doctor that is something that is mixed with fentanyl or other types of synthetic drugs. And a lot of times those individuals are taking it and dying almost immediately. So we don't have some of the meth growth that we have in other areas of the state right here. It's still largely opioids. But I will say what's incredibly important here to mention is as we have nearly a 50-year crime low across the state of Florida, it is incredibly important for us to keep that. We know that crime is a symptom of another problem. And substance abuse and mental health and all of these things ultimately lead to crime. So what we're doing right now is we're addressing not only the person who's navigating that path towards recovery, but you have equipped us with the tools to make sure that we can hold the drug dealers accountable to the fullest extent of the law. It's a combination of those things, and it's also providing resources to support mechanisms. That's why the employers are so important, because they may be formally monitoring and evaluating somebody while they're at work. They may be the first person to see the sign of addiction, and to equip them with the knowledge and the experience and the tools to address that is going to be incredibly important as we move forward.
Right. Can you just talk about a little bit, Career Source over the last 6-7 months? Obviously, we were in a much different situation in February. Then as we got into March, towards the end, you started to see, really significant changes. And so what's that process been like?
We have. It's quite a tumultuous period since February, going through what we've gone through with this pandemic and how it's impacted employment. We've had over 1,000 warn notices from the state letting people know that over 50 or more people from their companies are going to have to be laid off or furloughed. And that breeds this and continues to populate this situation. But what we know is that there's so much talent in these individuals, and behind these big numbers are real people. And being able to use the workforce system and getting people connected to careers with portable skills, with measurable confidence in a credential that equates to a new wage, that helps, and you balance that with getting awareness of the stigma and being able to address it at an employer site and letting people know in their faith-based communities, in their workplace communities, how to be able to spot a family who's struggling, a person who's struggling, a spouse who's struggling, and be able to complement that assistance. And with this grant, we're going to tie all that together. So I'm really thrilled that we're going to be able to have training that's going to give people access to new growing careers. Really are high growth areas. We're seeing a lot of employment opportunities in tech and in transportation, and I see a lot of these skills that will be able to get people employed and get the benefits that Katie said. I mean, we want to make people have careers, not just jobs. We want you to have the full benefit and stay here, work here, and enjoy the state of Florida. So I'm very appreciative, and like the First Lady said, we really want hope with this, but hope with data to verify it. So you can count on the Career Source Network to be able to show exactly the numbers of people we're talking to, working with, and how they're progressing over this 4-year period.
Great. Well, thank you guys. We look forward to seeing some results out of this. I think as you look, I think a lot of people have touched on it, but it's really important to continue to give people opportunity to work and earn a living and put food on the table. Some of this stuff right here in Central Florida knows more than anybody. I mean, there was a decline in people coming, and I know Disney closed and Universal this, but even if they had not done that, we would have seen a decline. I think you've had a very successful summer, and I think you'll start to see more and more. Obviously, things like conventions and all that all plays into this hospitality, which has really been whacked very significantly, and that's had a real major impact on a lot of people's lives who are working hard in this industry. It's a very important industry for our state and obviously for this region. So we're making strides there. It's not just in our control. Obviously, we want people to feel comfortable about doing that. But I also say that we have already seeing opportunities about investment in Florida and jobs being moved and business being moved for a variety of reasons. I mean, some of it is just the same factors that we've seen cause businesses to move and jobs to be moved here over the many, many years with the different tax structures, the different regulatory approach, the fiscal solvency. I've talked to some big companies who, they don't like some of the stuff that has gone on in some of those states, but now they look forward and say, man, there's going to be huge increases in taxes because some of these states are just flat out broke. And so that's going to give us more opportunities. And then I also think the unrest that we've seen in some of these states. I spoke with a CEO who had a headquarters in downtown Minneapolis, and that was not a good scene there. And so people, when that happens, they tend to want to find greener pastures. And so we've obviously had a different approach to that in terms of disorder. We're just not going to tolerate it. And then I think the fact that the states that have approached COVID in a more targeted way without totally destroying and kneecapping their economies are places where businesses are going to look to go. And I think we're seeing in Europe right now, I mean, they were supposedly Fauci in July said, oh, they did it right because they locked down so much harder than America. Well, it turns out massive increases in a lot of these countries now. So they did all this stuff, they caused all this damage, and yet they're still having to deal with it. So we should learn to see kind of what works and what doesn't. But certainly doing things like totally shutting down an economy, it just doesn't work, and it causes all these other problems that we're talking about. And forget about even losing jobs, which is huge, and all this. Just the loneliness and the despair that people feel when society's in the fetal position. So we have an obligation to continue to give parents the opportunity to put their kids in person school, provide as much economic opportunity for people so that they can earn a living. And I think that you're going to see some opportunities. We had huge demand for home sales during this whole time. How homes are still being built. So you're continuing to see people look to Florida as a place that they want to be. And so we got to look at all these different things. It's not just one segment of any of this, whether it's just health, there's so many facets to that. But then social health and economic health are all very, very important. And then finally, I just note, if you look to see what the economic forecasts were, President of the Senate put out a memo today outlining the increased revenue that we've seen above expectations. It's been pretty dramatic over the past couple of months, and I think you're going to continue to see momentum going forward, and that's certainly our hope. So with that, I and the others are happy to take questions. Yes, sir.
Hey, Governor. Good afternoon. Thanks for doing this, by the way. We still haven't gotten yesterday's numbers from DOH on the number of people tested for COVID, obviously. Any idea what's going on with that? Also, we just heard from HHS. I'm sure you're aware a couple hours ago they have 6.5 million of rapid tests coming to Florida from the federal government, largely going to schools, nursing homes, your office, of course. Would you talk about that? Also, how it seems fewer people are actually getting tested.
Well, I don't think the last part's true at all. We did, a couple days ago, we did 133,000 tests reported in the state of Florida. That's the second most the whole pandemic. The one time we had a little bit more than that was 140, and that was the, quote, record high when everyone was saying there were 15,000 positive tests. They never said that there were 144,000 tests. But now we basically had that same amount recently and had a small fraction of that. And so I think we've averaged probably about 75,000 tests a day over the past 7 weeks. We have known we were going to get these rapid tests. We've deployed them so the federal government's sending them directly to 800 skilled nursing facilities. And part of that is the nursing facilities are going to have to follow the mandates of testing of the staff so that we're able to identify a staff member that may be infected and isolate them so they don't infect the residents and it doesn't spread in what's a very high-risk congregate living type of environment. But there's also 3,200 other long-term care facilities in the state of Florida, which the feds didn't send directly. So what we're getting, we've sent them out to all those facilities, and again, can be used for the same thing, screening staff, but also can be used for screening visitors. One of the biggest successes we've had over the last couple of months is streamlining and green lighting visitation in these facilities. It's obviously a concern initially about bringing the virus in because of visitors, and I think that was a legitimate concern, and we obviously acted on that because we viewed those residents as our most vulnerable to this disease, understandably. But kind of goes with what we're saying here when you talk about isolation. Well, just think if you're in one of these facilities and you're having to do FaceTime or phone calls and you couldn't see people. So this was going on for months and it was causing a big problem. And so my view was, look, we know how to mitigate. Nothing is foolproof. But we had the stuff with no visitation, all the PPE, all the testing, everything you can imagine, and you still had outbreaks, unfortunately. So it's not like having everything like that meant that you were scot-free. You weren't. It was always going to be risky, no matter what. And so we figured if you mitigate, you should be able to have loved ones go in. And when we did that at the end of August, we thought, we think we can mitigate, but we do understand, you may see cases as a result of this. But I think most of the residents were of the mind that they would rather live life with precautions than not have the ability to do that and see their loved ones. But interestingly, you've seen a huge decline in the number of cases. It's kind of flatlined in the last week or so, but I mean, we're at way lower levels than we were 2 months ago. And I think that there's a lesson in that. I think people do better when they're happy, when their spirits are high. And I think that it was the right decision. But we didn't say you had to test everyone coming in. For the simple reason is logistically, you do a PCR test on Monday, you get the result on a Thursday, then you go visit. Well, who knows whether you were infected in the intervening days? Well, now that you have rapid testing, they have the ability, if they want to test the residents, they're able to test the residents, the staff, and all the visitors who come in. And so we believe that it's a tool to help keep people safe, but it's also a tool to help expand the horizons so that people can live as full a life as possible. And so that's 3,200 facilities that we've sent hundreds of thousands of tests to. But we also understood that, yes, there's a huge difference. If you look at the mortality, if you're 70 plus and you're in a long-term care facility, your mortality is significantly higher than if you're just 70 plus with not significant comorbidities living alone or whatnot. But at the same time, age is the most significant factor in this. So we have senior communities all throughout Florida. So we said any senior community that wants these tests, we'll send them right to you. The Villages in Central Florida, places like Sun City Center in the Tampa Bay area. And so anyone can ask for them. It's rapid test for seniors at em.myflorida.com. And so we've sent hundreds of thousands of tests to those communities. So we're looking at it as, maybe the residents, they probably aren't going to need to be tested all the time. I mean, they're living in normal residential communities like anyone else will. But if you have people coming over for the holidays, if you have family members, community has that, just set it up so that you can use it to do that. So we think that that's a really, really good thing. So we've sent out hundreds of thousands already. We haven't gotten the most recent shipment. They're going to continue to send them on we thought a weekly basis, but it's been about 12 days since we received the last shipment. But we're going to continue to really focus that on the protection of elderly and people that are the most at risk for this. We have sent some for schools for if somebody is sick and you send them home. If you can do a rapid test and they're negative, well, then they don't have to isolate for 14 days. And then also, we're seeing some schools, anybody that was in, quote, contact, healthy kids, are being asked to isolate for 2 weeks. I think that's a mistake. Now that you have a rapid test, okay, test them. If they're negative, then they need to be back in school. I don't think you really need to test them if they're healthy. I think you can monitor for symptoms, but at least you have the tool to do that as well. And then what we're going to do is we're going to give them the first responders. So as we get more shipments in, we send them to our sheriff's departments, we'll send them to our police departments, our fire departments. And again, not that they need to be testing every day, but if you have a situation, you can get a quick 15-minute result. And that's really a force multiplier for them, because if you can't get the result for 2 or 3 days, what are you going to do? You just have people isolate. So we think that that's good. Now, there's the 15-minute rapid tests are a little bit different than the PCR tests. The PCR tests are super, super sensitive. So if you're infected 3 weeks ago, you could still test positive on a PCR. You're not contagious, but you can still test positive. The antigen rapid test, you're probably not going to test positive unless you have an active infection. I think that's a good thing, because you don't want to isolate people who aren't infectious. If you're not infectious, then you need to be live your life. On the other hand, the antigen has higher false positives, true false positives. So it's about 1.5% of the tests will be people who are not actually infected or have never been infected, and then they will come back positive. So there are some folks who, if they do get a positive antigen, are having it confirmed with PCR, and that's fine. So none of these tools are perfect, but I feel that having a 15-minute option, can be good, and we do think that it's about as good for a rapid test, as is available on the market. I've demonstrated it in different parts of the state, but it's literally like a little card. There's a box that a bunch of them come in. You take it out of the package, it's a card, and you do just 6 drops of the reagent. You take the swab. You don't even have to stick it all the way up to your brain like some of these are. Just do an each nostril, put it in, close it, there's adhesive, and give a result within 15 minutes. So from where we were in February, when the CDC was recalling the tests that they sent, and we had no way at that point, but then even as we started to see more PCR availability, and sometimes the labs would take 7 days to turn around, to have a 15-minute test, again, not 100%, but I think a useful tool is big. So we're going to continue. So we've distributed hundreds of thousands already, and we'll continue to do it. But we think focusing on our elderly population, not just nursing home, not just long-term care, but seniors throughout Florida, and then the first responders, and then some of the schools is the best use of them. Yes, sir.
I've got a couple questions about the program you're doing today. We've talked about the job loss in employment. This program helps to get people new jobs. Is there concern that because there's so many people unemployed now, there could be more down the road? I know it's probably not going to be overnight. These people go back out, after they're treated. But is there concern that it's setting them up to fail because there might not be a job for them to go to? Is there concern with that?
What do you think?
I don't think so. I think that obviously the number one focus is needing to get the economy back on track, but there is a focus, of course, with people that are going through the system to make sure that we connect them with the right job. So we need to be doing everything we can to get the Florida reopened and back out there. But anybody who's having opioid addiction struggle, quite frankly, we need to try to address their concerns, and that's what we need to do and make sure that they are addressed. And then when they're coming through the program, then we look forward to helping them find employment. But I don't think at all we're setting them up for failure. In fact, we're trying to give them a hand up and offer them assistance and do everything we can to make sure that they do find employment.
And Governor, the other question I had was about the tourism industry here in Central Florida. We rely heavily on visitors from the United Kingdom and Brazil. There are proclamations from the White House that is keeping these people out of the country right now. Do you think the president should lift those restrictions on them coming into our airports? And have you talked to the White House and the president about lifting those?
Yes, on both counts. I do. I mean, I think that, and I was somebody in January when hardly anyone was talking about the coronavirus to say, Mr. President, stop the travel from China. And I think that was the right thing to do. At the same time, we have to look at where we are now. The virus is endemic. It's not like if somebody comes, that's going to be introducing something that's not in anywhere. You look, the Northeast had their cycle. The Sun Belt had a cycle. Now the Midwest and the Great Plains is having a cycle. Europe, these places that didn't really get it, are now getting it. So it's really just a matter of taking precautions, and particularly if you're in the higher risk groups, to make sure that you're taking precautions. Obviously, we want to be helpful with that, with testing and PPE, whatever we can do. But like Brazil, they're on the backside of their, I mean, they had an outbreak over our summer, over their winter. And I think allowing that travel to resume makes a lot of sense. I support it. I think Europe is just, because of what they're going through now, they may not do it. But I mean, my view would be, you know, these airplanes, one, are not been sources of outbreaks, which is very interesting. And it's, you know, it's still, we still really don't know exactly the best way that this is transmitted in terms of, is it more droplets, is it aerosolized, whatever. But on these airplanes, you've had hardly any outbreaks, and you think your people are there. And it's not just like you know, people wear masks, because they weren't wearing masks in March, and you didn't have outbreaks then either. I think it's something with the way the air circulates. So flying is very safe, and I know not everyone has been willing to do that, but more and more people are willing to do it. So apart from the international, throughout the United States, I mean, we really believe that flying is important, and I think it's safe. But I do think United Kingdom, I think that we should relax that. Heck, even if you wanted to impose, and I'm not saying you have to do this, but they have all these rapid tests. You can test people if that's what you're concerned about. But to shut it off entirely at this point, I think is counterproductive. I think it would be very good for this part of the state to be able to have you know, that travel back, and I just don't view that as being something that's going to really alter the trajectory of COVID here. And I obviously, when you're talking about people staying at Disney World, some of these other Universal, I mean, those places have taken a lot of precautions. I think they've had a really good track record. I mean, when even the New York Times is acknowledging, you know, no outbreaks at Disney, you know, you must know that they're doing something right. So I think it's important. The other thing we think, and I know, you know, you go off to the coast here, it's important, is the cruise ships. You know, we want to see the cruise ships sail again. They have been sailing in different parts of Europe, and I think largely has been very successful. Obviously, that is going to be an environment that is a different level of risk than going to an outdoor football game or some of these other things. And I know they've thought hard about it. They've done a lot of different things. I think these rapid tests can be very useful for that. But that's an important engine for our state. I mean, we have thousands and thousands of people who work, and it's not just working directly for a cruise ship. It has all kinds of impacts throughout different parts of Florida where these ships leave, Central Florida, South Florida, Tampa Bay. And we want to see that resume. So I've worked with the White House on that. I do believe the president is supportive of it. We are thinking about probably doing something with not just the cruise ships, but showing, I think, folks just how broad of a reach this has in terms of people being able to earn a living and put food on the table for their family. So it's really, really important. And again, we have so many more tools now than we did before. And I'm not saying they have to test every single person that goes on the cruise ship. But if they wanted to, they probably could now. You don't have to send it to a lab. You don't have to do all this stuff. So the possibilities, I think, are really, really good. And we should always try to figure out, how can you get to yes? Not just say we can't do something. Say, no, we need to do it. And no one would ever be forced to come visit or go on a cruise. And if you're not comfortable doing that, God bless you. But I think there's a lot of people that would like that opportunity. And I know there's a lot of people that would like the opportunity to earn a living doing it.
One more question.